Welcome to the 2025 Open Enrollment presentation for retirees. The enrollment period is March 3rd to 31st, 2025. What to know for 2025? There are no premium changes. That is correct. Plans will also remain unchanged. The City of Houston is updating the 2026 plan year enrollment to reflect the calendar year. In preparation for this change, this will be the last spring enrollment for employees, retirees, and survivors. All deductibles and maximum out-of-pocket expenses will be prorated to reflect the shortened plan year. There will be a second enrollment in November 2025 for all benefits to be effective January 1, 2026, December 31, 2026. Starting with the 2026 plan year, your benefits enrollment will be streamlined. Enrollment for all benefits, including Medicare Advantage plans, will be in November each year, and deductibles and out-of-pocket maximums will align the calendar year. What do you need to do? Nothing. If you are satisfied with your current benefits, you don't need to do anything. All your current elections will roll over into the new plan year. You only need to log into Benefit Place to add coverage or make changes to your existing coverage. Your retiree benefits participation options are: Option 1, make no changes, all benefit coverages will roll over if you do nothing. Option 2, opt out of coverage. Option 3, enroll, opt in, or make changes. First, I'll go over your medical plan benefits. The City of Houston offers 3 Cigna medical plans for our eligible employees: a consumer-driven health plan, or CDHP, a limited network plan, similar to an HMO, and an open access plan, or OAP. Let's talk about how these plans differ. The CDHP offers a low paycheck contribution and includes a health reimbursement account, or HRA, to help you lower the cost for services. The city pays for the first $350 for an individual or $700 for family from the health reimbursement account, which can be used to offset your deductible or co-insurance costs. The amount in the HRA depends on your effective date. Under the CDHP, you have access to all Cigna providers throughout the country, without having to seek referrals to see specialists. There are no co-pays on this plan, meaning that you will pay 20% utilizing in-network or 40% out-of-network for the cost of your doctor visits, hospital stays, lab work, x-rays, emergency room visits, and outpatient procedures after you reach your annual deductible. The in-network annual deductible on this plan is $1,150 for an individual and $2,350 for family coverage. The out-of-network annual deductible on this plan is $2,350 for an individual and $4,700 for family coverage. Remember that these deductibles are offset by the health reimbursement account. This plan also includes a 4-tier prescription drug plan, which also utilizes the 20% coinsurance for in-network or 40% for out-of-network. Please take a moment to review the biweekly rates on the screen. These include discounts for non-tobacco users. The limited network plan allows you to choose from 3 provider groups: Kelsey Sable, Renaissance, Village Family Practice. This means that you will need to coordinate your care within these networks. In the limited network plan, you have a lower deductible and pay less for services. The limited plan has a $125 annual medical deductible for individuals and a $400 annual medical deductible for family. Additionally, you have set co-pays for primary care visits and specialists. The limited plan has a $100 annual prescription deductible for individuals and a $300 annual prescription deductible for family, except for certain preventive medications which are not subject to deductible. The limited plan does not offer a health reimbursement account, so the city is not contributing towards the cost of services like the CDHP. If you designate a primary care physician in the Village Family Practice or Renaissance Network, you will need a referral from your PCP in order to see a specialist. If you designate the Kelsey Sable Network, you do not need to choose a primary care physician. With this group, you can visit any Kelsey Sable office in the Houston and surrounding area. You do not need a referral to see a specialist as long as you stay within the Kelsey-Sable network. At the time of enrollment, a PCP will be assigned to you based on your zip code. As soon as you receive your insurance card in the mail, please contact Cigna directly, either the 800-997-1406 number or one of your on-site Cigna reps at 832-393-6000 and press the prompt for Cigna to update to a provider of your choice. You and your dependents do not need to be enrolled in the same network. For example, you may choose a PCP in Renaissance or Village Family Practice while your spouse chooses Kelsey-Sable. You may change your PCP once a month, as long as you contact Cigna before the first of the month. Please take a moment to review the premium amounts on the screen. These are the biweekly amounts, so long as you and all covered dependents are non-tobacco users. The Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other two plans. The OAP gives you access to Cigna's national network without a need for referrals to see specialists. The OAP has an annual deductible of $550 for individual and $1,100 for a family. Once you have met this annual deductible, you will pay 30% coinsurance for most services until you reach your maximum out-of-pocket amount. You will have a set copay of $40 for primary care visits and $65 for a Tier 1 specialist or $80 for a non-Tier 1 specialist. The OAP includes a 4-tier prescription plan with no deductible to meet. Please take a moment to review the premium amounts on the screen. These are the biweekly amounts, so long as you and all covered dependents are non-tobacco users. The 3 medical plans have differing co-payments and coinsurance amounts for prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible of $1,150 for an individual and $2,350 for a family. This plan also includes a 4-tier prescription drug plan, which utilizes the 20% coinsurance for in-network or 40% for out-of-network. The limited plan has a separate deductible from the medical deductible, so this is an additional amount you will need to pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible at all and offers a tiered copay and coinsurance amount for different drug classifications. Please review the cost for prescription drugs by verifying which tier your prescriptions fall under and carefully consider your options when choosing your medical plan. 90-day prescriptions have a higher copayment or coinsurance than 30-day prescriptions. Specialty drugs in the limited network and open access plans are only available as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express Scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription, which can save several $100s a year depending on your usage. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains and wholesale warehouse stores, all places where you may already shop. 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey, Kroger, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network, including CVS, Target, Kroger, Walmart, or you can use Cigna Express Scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with 90 symbol. Cigna has partnered with Cigna Express Scripts to offer savings on many generic and name brand drugs through mail order. Signing up for Cigna Express Scripts is easy and convenient, with your prescription shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetic medications, preferred brand diabetic test strips, and brand name insulin. Additionally, if you are a member who is not enrolled in Medicare, you are eligible for a free diabetic blood glucose meter. Call Cigna Express Scripts at 1-800-835-3784 to get started. Now I'll go over your dental plan options. The City of Houston is excited to offer 2 dental plans for eligible employees. You have the option to choose between the Cigna Dental Care or DHMO plan and Total Cigna DPPO plan. The Cigna Dental Care DHMO plan is a cost-effective plan that has fixed copays for dental services, with no deductible or annual maximums on services. You will need to select a primary care dentist and will need a referral to see specialists. The service area includes all of the United States, except for 13 states. You will not have to submit claim forms on this plan, unless you choose to use services out of the network. There is no charge for preventive services on this plan along with fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more plan information, refer to cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $30 per individual and $100 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $1,300. The plan is based on coinsurance levels that determine the percentage of costs covered by the plan for different types of services. For example, Class 1 expenses are preventative services like cleanings and certain X-rays and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%, and Class 3 expenses are major services like bridge work and crowns and are covered at 50%. Next, I'll go over the details of the Vision Plan. Do you know that eye health is an important component of your overall health? Eye exams can detect many chronic issues, including hypertension, autoimmune disorders, cancer, and thyroid disease. With the Vision Plan, there are no annual deductibles, just simple copays when you use in-network benefits. You will pay $20 for your annual routine eye exam and $25 for your glasses or contact lenses. The $25 benefit includes a $150 allowance toward your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Please refer to the City of Houston's HR benefits website for more details. Superior Vision offers many providers to visit for your eye care needs, including EyeMasters, Vision Works, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit www.superiorvision.com. Outside of open enrollment, the only other time you can make a change is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common qualifying life events are marriage, birth or adoption of a child, divorce, gain or loss of other coverage, and moving outside of the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence by accessing Benefit Place through HR 1. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26, over whom you have legal guardianship or legal foster care. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled and covered on a medical plan before reaching age 26, and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide healthcare coverage, you must provide the Benefits Division the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The City of Houston requires that employees submit appropriate documents for all eligible dependents to be covered on health plans. The city requires proof of identity such as a social security card or ITIN, and proof of eligibility such as a birth certificate, certified marriage certificate, or legal adoption paperwork. Please be advised that you will also need to provide all dependents' social security numbers and dates of birth to enroll. The list of required documents is available on the Benefits Division website at cityofhoustonbenefits.org. All supporting documents for Open Enrollment 2025 must be submitted through Benefit Place only by accessing the Document Center. If you are adding a dependent, you must submit supporting documents by March 31, 2025, no later than 10:59 p.m. Central Standard Time. If both you and your spouse work for the City of Houston, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the City of Houston. There are 5 ways to submit a form. Drop Benefit Place. Go to benefitplace.houstontx.gov to complete and submit electronically, along with supporting documentation in the Document Center, if applicable. This is the fastest way to complete your open enrollment changes. You can also mail to City of Houston Benefits Division, attention, Retiree Benefits 611 Walker, 4th floor, Houston, Texas 77002. Or email to retireebenefits@houstontx.gov. Or access, complete and sign a fillable PDF form. cityofhoustonbenefits.org. Upload documents using the Secure Document Submission Portal. COH-employees.org/secure-form. Delivered to the Benefits Division in person. March 3rd to March 31st, 2025. Bob Lanier Public Works Building, 4th floor, 611 Walker, Houston, Texas 77002. Extended open enrollment hours are Monday to Friday from 7 a.m. to 5:30 p.m. Did you know you can receive updates and reminders from the Benefits Division by email? The City of Houston offers a safe and secure paperless option to receive communications about open enrollment, newsletters, and other important updates. Get notified faster. You'll be the first to know when you sign up for electronic delivery. Protect against identity theft. You have less risk of information from the Benefits Division being lost or stolen in the mail. Reduce clutter and save trees. When you switch to electronic delivery, you're helping the environment by reducing paper waste. To sign up, go to cohemployees.org/retirees or scan the QR code. Enter your email, first and last name, then click on Sign Up. It's that easy. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing retireebenefits@houstontx.gov, calling 832-393-6000, or faxing 832-395-9409. You can also view more benefits information on our website, www.cityofhoustonbenefits.org.